Here at Big 550 KTRS, Nancy Kelly is with us. Nancy, thanks for getting up early.
Thank you.
You want to say hi to your mom and dad?
Good morning. Hello, everyone. Thank you for listening.
Your mom's a big listener to the show?
Yes, she is.
Your dad, not so much?
No.
All right, well, we got to work on that, Dad. Come on now. What are you doing? You were with the St. Louis Effort for AIDS. What's coming up this weekend?
We have an enrollment event. We're calling it an enrollment party. It's part of Cover Missouri Coalition activities. We have events all over the state. A big push to help people understand a little bit more about their options and the benefits of enrolling in health care through the marketplace.
All right. Now, some big news came out yesterday. President Obama said what? What did he say? He said that individuals can keep their own health insurance for another 2 more years, right?
Well, right. And there's, some changes as the law has rolled out. We are working with that because our goal is to help people get insured. And so if it's keep your insurance, that's a plan you want to keep, great.
Right.
We also want people to know there are other options out there, sometimes more affordable or maybe better coverage.
Yeah. This is, it's so convoluted and so confusing. If you are working and you do not make enough money, how much money do you have to make, I guess is a better way, to be subsidized by the federal government?
Well, that's a great question. I'm glad you brought it up because I think a lot of people don't realize that there are those subsidies. So there's discounts out there to help people to afford the insurance. And the subsidies actually kick in at what's known as 100% of the federal poverty level,
right,
which means that a person is earning $11,500 approximately. So if you earn over that, up to 400% of the poverty level as an individual, which is about $46,000, there's going to be those tax credits. They're
right,
going to save you on your monthly premiums.
And it kind of depends on how many kids you have and your marital status and all those types of things.
Absolutely. There's several factors.
Right. But what's interesting is that if you make below that, you're on your own.
Well, that's one of the goals of the Cover Missouri Coalition.
Right.
We joined, there's about 400 entities throughout the state, and we are in favor of Medicaid expansion. Currently, Medicaid in Missouri only covers up to about 19% of the federal poverty levels, which is about less than $4,000 a year. So there is that gap between $4,000 and $11,000.
Yeah. You and Kit Bond.
We're right there together, Kit Bond and me. Yep.
That's important to know because if you make over 100% of the federal poverty line, the federal government will subsidize you. If you make below that, no one's subsidizing you. You're on your own. If you make nothing, or it's like $1,000, $2,000, then Medicaid in the state of Missouri will pick you up. So there's an actual, well, they call it a donut, if you will, of people that the state chooses to turn down the federal money. So there's money out there for those people to be insured. The state of Missouri is just choosing not to take that money.
That is accurate. About half the states in the United States are accepting the money. They're going ahead. They're covering those individuals. They're helping them to get the health care and the health coverage that they need. We are confident that our legislators will understand this issue the way we do and help out those people at the low income end of the scale.
Nancy, I heard the website wasn't working.
The website is working now. Early on, the website started in October. October was not a good month. That's no secret. There's been vast changes, and often when we help people to enroll, it takes less than an hour.
I have heard, I've gone online to the website, and I have done everything except hit the final button. I wanted to see how much it would cost me. I wanted to see, compared to my plan that I get through the radio station. I was shocked at how simple it was, how easy it was. And what was really interesting was they didn't ask me one health question, right?
Right. Well, I appreciate that testimonial because the marketplace is user-friendly. There is a calculator in there that you can put in your numbers for your income level, where you live,
right,
your age. Those are the factors they consider. The only health-related or maybe behavioral issue they ask about is tobacco use.
Smoking, right. Yeah, right. Because they can charge more for tobacco users.
Right. I understand because tobacco is associated medically with so many.
Right. I think they should charge a lot more for people who choose to smoke, and they should charge more for people who choose to be overweight. But that's just a whole other issue. All right. So what's the most important thing? What do you want people to know? Where do they go? How do they find out more information?
I have a website for you, which is www.covermissouri.org. If you go there, you can link to healthcare.gov, which is the marketplace. Just as you did, go check out what your options might be.
Right.
Tons of information there about what the coalition is doing, as well as a calendar of events. If you scroll down to the bottom of the homepage, there's a calendar of events, including our event that's coming up Saturday.
What happens if you don't sign up for insurance?
Well, there are penalties that will kick in if you are 3 months or more in 2014 without coverage.
Yeah, March 31st is the deadline.
Absolutely. March 31st is the end of open enrollment, so you need to get yourself enrolled by then.
What happens if you don't? What happens if you lose your job April 2nd and you don't have insurance? What happens then if the deadline's March 31st?
There are special enrollment options. So if you lose your coverage or you have a baby or you get married, there's that life change in some way. The marketplace will open up for you and you can come back in when it's not open enrollment time.
Let's say somebody is 25 years old and they're on their parents' insurance policy. And in April, after the deadline, they turn 26 or 27 and they have to get their own insurance, but they missed the deadline.
That's okay, too, because that is considered that life change. It's a loss of coverage. They're no longer eligible for the parents' insurance, so that would also open up that enrollment.
Yeah. What's the penalty? Do we know what the penalty is for not enrolling?
It's a little bit variable, but it's a financial penalty. I know there's been some, talk about other things that might happen, get thrown in jail, things like that. That is not the case.
Right.
It's a financial penalty that works through the taxes, and it's $95 a person or 1% of your income, whichever is higher.
What are you hearing from younger people? Are they wanting to sign up for this? Are they avoiding it like the plague? What are you hearing from the younger generation?
Well, in Missouri, we're pretty excited because the percentage breakdown is actually pretty encouraging. We've got probably about 30% of the people enrolling are actually in that younger demographic. And you might be surprised. I think sometimes young people don't get credit for being serious and kind of understanding some bigger life issues. But there's been people who are surprised by what they can get, and they're excited to enroll, and they are enrolling.
Yeah. All right. So just so we know, the website for more information?
www.covermissouri.org.
And that's for those of you who make 100% or more of the poverty level.
Yes, when we would encourage everyone to go there just to get more information.
To see where you fall.
Mm-hmm.
But just remember, if you fall below the poverty level, below the 100% poverty level, you're on your own.
You're on your own.
Better get a better job or work harder or make more money so the federal government can then subsidize your insurance. And
can I add to that, if you would like to call your legislator and let them know what your experience is, that'd be very helpful.
Yes. So, right. So, but if you're working 3 jobs and still not above the poverty level, the state of Missouri is telling you to work harder and to make more money so you can get subsidized.
Essentially, that's true.
Nancy Kelly, thank you very much for coming in. Tell your mom I said hi. Tell your dad to start listening.
Thank you very much.
6:31 here, Big 550, KTR1, KTRS.